Hi, I'm Autumn, and today I'm presenting on peer recovery specialists, a widely used non-clinical intervention in substance use treatment. Before I begin, here's my student ID. Okay, moving on. Okay, so what is the intervention? Peer recovery specialists or recovery coaches are people with lived experience of substance use and recovery who are trained to support others. They are non-clinical, meaning they don't provide psychotherapy or prescribe medication, but they provide mentoring, practical navigation, emotional support, and advocacy. PRS work in many settings, including community programs, harm reduction sites, hospital emergency departments, correctional reentry programs, and they also conduct themselves alongside treatment facilities. How it's applied in treatment. In practice, peer recovery specialists are integrated into care in several ways. They accompany clients to appointments, link people to medications for opioid use disorder, deliver brief behavioral supports, facilitate peer support groups, oh my goodness, and help clients access housing, employment, and legal services. The model emerged from recovery movement and has been formalized over the last 15 to 20 years with certification programs in many states. I'm so sorry. So moving on to a summary of the evidence. What does the research say about effectiveness? Overall, studies consistently show that peer support increases engagement and retention in treatment. In other words, people who work with peer specialists are more likely to start and stay connected with services. Substance use outcomes are more mixed. Some studies demonstrate reduced substance use or relapse, while others are inconclusive, largely because the interventions studied vary in design and quality. Importantly, peer specialists also improve linkage to health services such as HBC treatment and MOUD, and they tend to increase social support and self-efficacy among participants. MOUD stands for Medications for Opioid Use Disorder. Okay, moving on to be more specific. 3 key peer-reviewed sources are helpful. Rafe conducted a review showing improved engagement and some evidence for reduced relapse. HUSC reviewed US studies and reportedly generally positive effects but flagged methodological limitations. And STAC summarized evidence across settings and found strong support for PRS improving engagement and linkages to care, with promising but variable substance use outcomes. Okay, moving on to slide 6, recommendations for practice. Based on the evidence, here are some actionable recommendations for counselors. First, integrate PRS into interdisciplinary teams and clarify scopes of practice so peer specialists complement, not replace, clinical care. Second, provide standardized training and ongoing supervision. Training improves fidelity and outcomes. Third, use PRS strategically for outreach to hard to reach or mistrustful populations, such as those experiencing homelessness or justice involved clients. Fourth, collect and monitor outcome data, engagement, retention, substance use, and linkage to services to, to continually assess effectiveness. Finally, address workforce issues like burnout, supervision needs, and fair compensation. Okay, moving on to slide 7, limitations and considerations. It's important to be candid about limitations. The evidence base has many small studies and heterogeneous program models, so generalizations should be cautious. Programs differ in training, activities, and settings. Counselors should ensure appropriate clinical backup, clarity on boundaries, and supports for peers' well-being. In conclusion, peer recovery specialists provide a promising non-clinical approach to substance use recovery. Evidence shows they improve engagement in treatment, retention, and psychosocial outcomes like self-efficacy and social support. While results on substance use Reduction vary. PRS clearly complement clinical care and provide a critical support system. For counselors, integrating PRS thoughtfully with proper training, supervision, and monitoring can enhance recovery outcomes and improve overall client satisfaction. That wraps up my presentation. Here are my references, and thank you so much for watching.